Bulavinaka, and welcome to another segment of Speak Your Mind. Today, Tuesday, the 29th of April, 2014. I'm your host, Sarafina Wedlock. Now, a field that is not so common in Fiji, chiropractic. Now, today, our guest in studio is Dr. Byron Cragen. Now, he's one of the two only chiropractors in Fiji, and he's our guest here this morning. Dr. Bulavinaka, and thank you so much for joining us.
Hi, Serafina. Glad to be here.
All right. First of all, tell us, what type of doctor is a chiropractor and what do they do?
Okay, well, a doctor of chiropractic is a physician of natural medicine.
Mm-hmm.
His main focus is the maintenance of the spinal column with its contained central nervous system and comprehensive nutritional factors for a comprehensive approach to natural health. Now, since the body depends on its nervous system to work properly, any interference to the normal nerve function can result in disease to the areas supplied by these nerves. Equally important is the chiropractor's role as a nutritional consultant, since most diseases have nutritional deficiency components that need to be addressed if one expects to maintain optimal health. Now, chiropractors focus on treating the cause, which can come from many aspects of life. Therefore, they use physical exams, verbal questions, laboratory tests like blood and urine, and radiographic studies, which are x-rays, as well as some very advanced computerized diagnostic equipment to analyze the patient and come up with a comprehensive idea of what the patient needs. Now, each person has individual problems, so we have to treat each individual properly that way.
Okay. How long have you been in a chiropractor?
I've been a chiropractor for about 30 years now. So
30 years? All 30 years in Fiji, or
no? Mostly, I practiced. I started in the United States. I got my education there, and I came over to Fiji on vacation, and I liked it, so I decided to relocate.
How long ago was this?
Oh, well, I got my work permit and started my practice at the Sheraton at Denarau, and 92, was there until 95.
Oh, wow. When did you come over to Fiji for vacation then?
1991.
1991,
Yeah.
And you got back in 92?
Yeah, I fell in love with the place.
All right. Okay, now, speaking of education, what type of education do chiropractors obtain?
Well, basically the same as medical doctor, except the chiropractors spend very little time studying medications, and most of the time studying areas of nutrition, vitamins, herbs, and physical therapies. Pre-med courses and pre-chiropractic courses are the same in the United States. Excuse me. Each has approximately 3-year minimum requirement. However, most students obtain a Bachelor of Arts degrees in some area of science, like biology, zoology, chemistry, psychology, before entering chiropractic or medical school. The minimum requirements include a year of chemistry, a year of physics, a year of math, a year of biology, and of course literature, art, history, political science, and all those things that are required of a Bachelor of Arts degree in the United States.
So overall, like, how many years do they have to go through school?
6. Well, usually it's 6 to 10.
So 6 to 10 years?
Yeah, it depends on what the person had prior to entering medical or chiropractic school.
Oh, okay.
Because everybody comes from different backgrounds. Some change their mind and they want to become a doctor. And
Right.
they might already have a PhD, for instance.
Okay.
And I had several people in school with me that the diverse backgrounds were incredible.
Yeah. So it depends. So basically from 6 to 10 years, depending on what background you came from.
Yeah, the minimum would be the 3 years, and then chiropractic school when I went, was 4 years, and they kind of condensed it to 3.5 because they left out your summer vacations and things. And
Okay.
So it's basically 5.5, 6 to 10.
Okay.
I entered with a 6 years of school.
All right. Well, speaking of your educational background, what is your educational background?
Well, I received a BA degree in zoology with the minor in chemistry.
Sorry, I have to ask, what is zoology?
Zoology is the study of animals. You and me.
Okay.
Not plant life, but animal life. That's like the zoos.
Right.
Zoology.
Oh, so you got
just all animal studies. Biology would be the study of animal and plant.
Yes. Okay.
So I received a degree in that, and postgraduate degree focusing on molecular biology and anatomy.
Mm-hmm. Were you always wanting to become a chiropractor, or did you? Well, I see you got a BA degree in zoology. Did you plan to go into that
Yeah.
first?
Well, I was studying to become an oral surgeon with aspirations to go into oral maxillofacial surgery. I had been accepted at the University of Southern California School of Dentistry when I switched to becoming a chiropractor.
Mm-hmm. Oh, so you actually did a lot of. Well, you wanted to specialize in a lot of things then.
Well, yeah, like I say, I changed my profession because something really happened to me, you know.
Right. Why the change in your profession? What made you want to be a chiropractor?
I had suffered a really serious work-related injury when I was on a summer vacation because did work in summer to earn money for school.
Mm-hmm.
And I hurt my shoulder and neck very, very badly, and I was hospitalized for a while. I had about 150 pounds of dead weight on my shoulder, and I fell on the ground with it, and so it really hurt me. And I was given various medications, some physiotherapy, but my symptoms persisted unchanged despite these treatments.
Mm.
And I assumed that a person with this type of injury simply had to live with it, since the health care I received was supposedly the best available, but it only gave minimal short-term relief. So as a result of these experiences, I learned to live with my condition. And I must say, learning with my condition, it was extremely difficult when the neck and shoulder pain became constant. Headaches developed into migraine headaches. I had insomnia. My studies really began to suffer. I became worried and seriously depressed. And you can imagine, you have these problems.
Mm.
And what do you do?
Exactly. So what did you do after that?
Well, I was referred to a doctor and who happened to be a chiropractor. I didn't know what a chiropractor was or what they did.
So they weren't established back when you were in school? You did not know much?
I found out later they were established, but for some reason there was no referral. I couldn't understand why. I told the guy, I said, why you? What are you doing? He says, well, I'm examining you. I'm doing stuff. And he did x-rays and felt the condition. And he felt like he really knew what he was doing. And it was the first time I'd had a sense that anybody knew what he was doing. And he said to me, he pointed out that the upper thoracic spine was damaged. The x-rays showed that I had 3 rib attachments and my shoulder was completely torn. And he said that these were causing the nerve and circulatory problems in my head, my neck, my shoulder, my arm, and my hand. And then he performed some spinal adjustments, which are called manipulations,
right,
to my neck and upper thoracic spine and ribs. It was an experience I could never forget. It was like immediately after putting my ribs back in place, my hand became warm for the first time in 3 years.
Oh, wow. And you know what? We'll find out a little bit more about what happened to Dr. Cragen when we'll be back with Speak Your Mind. If you just joined us, you're on Speak Your Mind on Gold FM. Welcome back to Speak Your Mind. And if you just joined us, well, we're with a chiropractor, one of the 2 that actually has a practice here in the country, and it's Dr. Byron Cragen. Now, he's our in-studio guest today. Now, doctor, you were telling us about how you got into chiropractic in the first place. So you went to see this doctor who was also a chiropractor, and he did some spinal manipulations on your back.
Yeah.
And then what?
My neck and upper back and ribs. And like I said, my hand was, I could feel it was warm for the first time in 3 years. And
right,
my grip was noticeably stronger. After he adjusted my upper cervical spine, I can't express fully how I felt. It felt tremendous.
I'm sure.
I told him I did not remember my head ever feeling this good. It was a delicious experience. I don't know how else to describe it. It was just incredible.
So this is the point where you decided you wanted to be a chiropractor, or did you have to go back and have a think about it again?
Yeah, I asked this guy, this doctor, I said, why had I not been sent to him 3 years ago by my treating doctors?
Right.
And he said that the other doctors didn't believe in his form of medicine.
Why is that, though?
I was totally blown away. I became very upset reflecting over the past 3 years of needless suffering. I did require treatments for the period of time, but I have no pain ever since. And even though my chest still remains a little deformed from the three years of being untreated, I'm doing really well.
Right.
So why did I decide to become a chiropractor? It was that time. I gave up my position at USC to enter their program, and I said I was going to be a chiropractor instead.
Mm.
I was so impressed that I thought that this was now my calling.
Why? Well, apart from, like I said, you said that they weren't mostly they didn't have patients referred to them chiropractors. Why was that? Why do you think that was so?
Well, I didn't find out until later that there was a certain amount of what we can call it. Let's see. I don't know, control in the medical profession that I just still didn't understand.
Right.
And I didn't fully appreciate that until probably the last 20 years of investigation. But the poor medical doctor, the people that basically control their education are the pharmaceutical industries, and they had influenced them in such ways that they didn't want them to refer to chiropractors. And the American Medical Association, which is basically a branch of the pharmaceutical industry in a way, they tried to keep their medical doctors from referring to chiropractors because they were trying to not have them be prosperous.
Exactly. Well, did this deter you though? Having known this, did this deter
I
you from
I didn't know
chiropractic?
anything about this until
later.
10 years after I graduated from chiropractic school.
Okay.
I got this in a big law case that came up.
Right.
That where the AMA was convicted of conspiring to wipe out the chiropractic profession.
Well, had you known this earlier, would you have continued or would you have pursued chiropractic though?
It's hard to say because my life as a surgeon would have been a lot different than it is here in Fiji as a chiropractor. So,
Any regrets though?
No, man. I some of the hardships you experience when you're what can I say, prejudiced against so heavily when you do such good. It doesn't make sense.
True.
It doesn't make sense. And that caller in just a little while ago, he knows.
George, yes, our friend George from Tamavua.
Yeah, and look at me. I'm a perfect example. 3 years, man.
Do you still have some of those?
No, I was suicidal. We're not talking about some little thing here.
Right.
Yeah, we're not talking about a little thing.
Now, for instances like situations like yours, did you also have other colleagues or maybe friends who have gone through the same experience?
Oh, yeah, definitely. There were many stories in chiropractic school similar to mine. I saw that the experience gave those students great conviction towards the profession they were entering, you know. One story in particular is memorable. I received a scholarship to teach human anatomy dissection labs in chiropractic school.
Right.
And in one of these labs, I met a student named Frank Berdici. He had told me I told him my story, and he told me his. And Frank was an Olympic hammer thrower for the United States. He was expected to win the gold medal the next Olympics. I can't remember which one it was, as well as set a new world record. This guy was a giant. And Frank hurt his back. He was like 6'8". He's just a solid muscle.
Really tall guy.
His pain became worse. He hurt his back, and no one seemed to be able to help his back. And his pain became worse and worse. And the orthopedic doctors told him his only option was surgery, and it would be the end of his athletic career. Well, Frank said, you know, my athletic career is over anyway. I haven't been able to, you know, work out for 6 months, and I can't stand the pain anymore. So he had the surgery done, and his after the surgery, he had the exact same pain, but now it was accompanied from pain from the surgery. And he was asked by his he was really depressed and heavily medicated all the time. But a friend asked him, had he seen a chiropractic doctor for another opinion? And Frank replied, "What's a chiropractor?" Like I did.
Yeah, exactly.
You know, and so he went to the chiropractor. After 5 visits, the original pain the surgery was done for was gone. It took another 15, 20 visits to resolve the pain of the surgery that the surgery caused, basically.
Right, right.
But his athletic career was still over. It was at this time that he decided to become a chiropractor and do all he could to keep this from happening to others. So he went back to school, got a degree in biology, and then went chiropractic for the next 4 years and received his degree in chiropractic medicine. He's practicing now in the United States in sports medicine on elite athletes, and books can be filled with the types of stories.
No, of course.
I mean, they're real. They're real.
Exactly. Now, doctor, since practicing in Fiji, what has the cases, or what has some of the common cases been like for you as a chiropractor here in Fiji?
What type of, excuse me again?
What kind of cases do you normally get since you've been a chiropractor here in Fiji? What are some of the common cases?
Well, there are a lot of neck injuries. I get sinus problems, headaches, a lot of sports-related injuries. I'll get some top rugby player that hurt himself.
Right.
And he's not able to perform at that elite level anymore, and he just kind of fades away. We're talking about some elite athletes here. And medication and physiotherapy simply isn't enough. And believe me, when you talk about sports medicine, all doctors should be involved, medical, chiropractic, and we utilize physiotherapy because that's part of medicine.
Exactly.
But so let's say let's say you're a top athlete that is a sprinter or a runner. You've hurt yourself repetitively several times. Well, that area that has been injured never fully recovers. And you start to lose your edge. And you can put physiotherapy on that. You can adjust the spine, but you have to go into that muscle nerve tissue and activate it and bring it back to life so that that athlete is carried by those muscles rather than him carrying those non-functional muscles. So it's something that all athletes can improve, but that's a special form of chiropractic that specializes in more like soft tissue, neuromuscular reprogramming techniques, and that's more of a specialty in medicine. It takes a little bit more time.
All right. Well, we'll talk a little bit more about the special chiropractic medicines that they practice. But yes, if you just join us once again, it's Speak Your Mind. We're heading into a break, but we'll be back with more. Welcome back to Speak Your Mind. I'm your host, Sarafina Wedlock. Now with us in studio, we've got Dr. Byron Cragen. He's actually one of the 2 chiropractors in the country. Now, Dr. Byron, earlier we had a caller, Mr. George from Tamavua, who's also a fellow countryman. He mentioned that you had cured him of sciatica, and also migraines, really bad migraines. Now, I did not know that we could go to chiropractors for migraines. Or for really bad migraines. Tell us a little bit more about how this works.
Yeah, migraines, that's a big subject, actually, so probably bigger than sciatica because migraines are so complicated. Migraine headaches are, in the medical profession, they're considered incurable, basically, and you just medicate. And when you have migraines, you're happy that that's what you have available. Believe me, you got them. You do anything to get away from the migraine headache. So you're happy to be medicated. But the chiropractic profession deals with what's causing 95% of the migraine headaches.
Okay.
And that's what we should focus on is the nerves and muscles and ligaments and joints of the neck, the upper neck, are primarily the causes of the migraine headache. And when you have a migraine headache patient, and since I've had them, I know there's nothing about a headache I don't understand.
Right.
So when I say to them, listen, I'm going to cause your headache, okay? I'm going to touch you in a place that you're going to feel some of the symptoms of that headache, whether it's a knife behind your eye or a hammer in the side of your head. Doesn't matter. You're going to feel some part of that headache. So I'll touch him in a certain place
Right.
in the upper neck or area that I know is contributing. And they're, oh, my eye. Feels like a knife in my eye or my head. I says, you notice I'm not touching your head.
Yeah.
Notice that. Now, where do you think your headaches are being caused from? Not your head, not your eye, okay? So leave that out of your head. Don't worry about your eyesight. Don't worry about a brain tumor at this point.
Right.
If I'm creating a headache from where I'm touching, that area I'm touching is going to be partially responsible for your headache. And then they start to go, oh, God, somebody knows what they're doing.
Right.
And it's sad, but that's true, you know. And unfortunately, the medical profession doesn't really believe much in chiropractic